Can I be joined by the folks from Iowa, the great state of Iowa? If you could please join me.
How you doing? Good to see you.
Jamie Summerfield from Thompson Brooks.
Good to see you. You bet. Thank you all for this honor.
Well, I'm about to introduce a man who almost needs no introduction, the ranking member of the Senate Finance Committee, Senator Chuck Grassley. Please join me in welcoming Senator Grassley to our evening.
Thank you.
We want to do more than just welcome you. We also want to recognize you. In your service, I know from meeting the DNA leaders from Iowa that you have long time championed their work and that you have embraced the importance of all they do. And in doing so, you've also recognized that the integrity of the work they do depends on the integrity of the Medicare program, and that their ability to continue delivering high-quality care depends on making sure that Medicare dollars are not wasted or subject to fraud and abuse. And you have been a vocal opponent of those who try to compromise what Medicare stands for. And throughout discussions around health care reform, you championed home health care and you championed efforts to fight fraud and abuse. And we are working with you to ensure the integrity of this program for years to come. And we wanted to present to you a modest recognition of all that you've done to make what nonprofit home health care and hospice represents with this award. Senator, thank you.
Well, if you ever wonder why I'm interested in home health care, I have never once run into an individual in Iowa who said, I'm just waiting to get into a nursing home. So thank you for this award, and I thank the visiting nurses for the critical service that you all provide to our communities and to the men and women who are so grateful to be in their homes instead of being in a nursing home. I hear regularly from Iowans that they prefer to receive treatment in the comfort and security of their own homes. So that's why I support professions like yours. I also appreciate your advocacy initiatives on preventing, detecting, and deterring fraud, waste, and abuse, and I'm glad to be recognized with this award for that purpose and my part in it. Medicare fraud is the equivalent of the Black Plague on one of the most important programs of our country. Millions of people rely on Medicare daily, and every dollar lost is a dollar lost to provide services to beneficiaries. Equally important, fraud, waste, and abuse take their toll on the American taxpayers who deserve to know that their money is being spent on services, not on fraudsters. Fraud, waste, and abuse in the Medicare program are also a problem for all of you, honest professionals, who must endure payment reductions that in turn compensate bad actors. Estimates are that approximately $60 billion a year is lost to Medicare fraud. For this reason, Medicare earned a spot on the Government Accountability Office list of federal programs that are at high risk of fraud. There are tools to fight Medicare fraud. One is the Federal False Claims Act. In 1986, I proposed amendments to the False Claims Act that would increase the incentive for an employee to blow the whistle on fraud. That act has recovered over $20 billion that otherwise would have been lost. Another tool for combating Medicare fraud is the use of the Recovery Audit Contractors, or RECs, as I say. In the past 3 years, Medicare RAC program has investigated CMS payment errors and has been able to return almost $700 million. Congress also passed the Seniors and Taxpayers Obligation Protect Act, or by the acronym STOP, which was intended to shift the government's practice of pay and chase to one of detect and payment. So I advanced this goal and I introduced a bill called the Strengthening Program Integrity and Accountability in Healthcare Act. It takes the common sense approach of allowing the government to withhold taxpayers' dollars for those under investigation for fraud. This legislation makes it harder for fraudsters to enroll in federal programs in the first place. Additionally, it would improve federal monitoring for fraud, waste, and abuse by requiring better data sharing and data access across the federal government. Also, with several other provisions, my bill would go a long ways to deter those who would defraud. More than ever in these difficult economic times, because we are still in a recession, or for those unemployed, a depression, we've got to do everything we can to protect taxpayers' dollars and the resources of healthcare programs. And I welcome the fact that you are ready, willing, and able to walk hand in hand with me to attack the problems of fraud, waste, and abuse in the Medicare program. And I'm very happy to have all of you as a partner in this project. And thank you once again for this award.